Eunice, can you tell us, what is lymphedema?
Lymphedema is tissue fluid that develops as a result of drainage to the lymph system. So for the woman who's had breast cancer treatment, because cancer spreads via the lymph system, the surgeon will have taken out 1 or 2 or more lymph nodes, and the radiotherapy will further damage the lymphatic system so that swelling can occur in the arm or the breast area.
How likely is it that you will develop lymphedema?
Well, it's actually more likely that you won't than that you will. Current research suggests that 1 in 5 women are likely to develop lymphedema at some point in their life. That means 4 in 5 don't. We know that most people who develop swelling will do so within the first 1 to 2 years, but we don't know who will and who won't. There's no way of testing at the moment. However, what we do know is that there are certain things that make people more likely to develop swelling than not. And the 3 that there seems to be good agreement as being likely risk factors are high body weight, so people who are overweight are more likely to develop lymphedema than if they weren't overweight, where they have repeated infections in the arm or the breast area, and excessive hand use like repetitive ironing, hammering, and increase the risk of developing lymphedema.
What are the signs of infection?
Well, typically they would be heat in the infected area, redness, swelling, pain. The redness may present as spots or streaks or a rash or just a general red blotchiness, varying from pink through to red. There's quite a variation. Sometimes the woman will feel unwell with it, flu-like symptoms or even a high fever. One thing is that infection does further damage the lymph system, so you do need to get treatment. If in doubt, best to go to the GP and see whether you need antibiotics. They will make that decision for you. And if the GP isn't available, then go along to the A&E department.
How do you know if you have lymphedema?
Well, if you have swelling, that's fairly obvious, but for most people, the early signs will be tightness in the arm, perhaps rings and jewellery are tighter or clothes are tighter. There might be some heaviness and aching, puffiness. Maybe you can't see the veins so easily on the back of your hand. But it's worth checking first off that you haven't just put on weight and that it's not just affecting both sides. The other thing to bear in mind is that if you have swelling that isn't in the area that's been treated, then you probably don't have lymphedema. If you have swelling, it's possible that it may be that your treatment, if you're still having cancer treatment, is contributing to that, and once the treatment is over, the swelling will settle down, particularly if you're having chemotherapy or radiotherapy. Some women find that the swelling will settle naturally, but you're not going to know whether your swelling will or won't settle. So if you have any of the signs that I've mentioned, it's worth talking with your breast care nurse and getting some help.
How does lymphedema affect you?
Well, my patients tell me that it's not a painful condition, although there may be an ache and a heaviness associated with the swelling at times. The first thing perhaps though to mention is that it's not life-threatening. It doesn't mean your cancer's returned, and that for the most part people can carry on life as normal.
What can you do to reduce your risk?
Well, my main advice would be to live as normally as possible. Live healthily, pace your activities, look after your skin so that you're reducing your risk of infection, lose weight or maintain a healthy weight so you're minimising the risk of that causing you to develop swelling. And I think it's also sensible to set up your workspace to keep your lymph drainage routes as straight as possible. Don't pull everything too close to you because that will cramp your lymphatic system, and build in regular rest periods when you're working, particularly if you're doing computer work or household chores like ironing.
There's a lot of information out there, some of which is confusing. Can you tell us about the evidence for exercise?
We've known for a long while, and it's quite clear that the lymph system relies on exercise. It needs a certain amount of exercise to function effectively. However, the advice for women for a long while has been don't do too much, and there have been restrictions applied. However, the research evidence is quite clear that exercise is good not just for your general health and well-being, but it's good for your lymph system. And even weight-bearing, weight resistance exercise, like going to the gym, pulling weights, can be done safely. There was a very reputable study that's recently been published with patients in the States where they randomly allocated over 100 people to doing exercise in a gym for a year and another 100 to not doing exercise in a gym, and there was no difference in how many developed lymphedema. I think it's fair to say that exercise is safe. I would personally add, and some of my colleagues agree with this, that exercise done on a regular basis is likely to protect you against developing lymphedema, as long as you're not overdoing it. Strenuous exercise done suddenly and without preparation is likely to be unwise.
What is the value of this exercise sequence in the next part of this film?
So this exercise program has been put together for people who have not been exercising for a while and want to do something to be more active, but don't feel yet able to go to perhaps a Pilates class or a yoga class or to start tennis again. So this helps to bridge from the post-operative exercises to help strengthen the arm and get used to doing a regular exercise routine until you feel able to move on to other forms of activity, whatever sport or exercise you were doing before or want to take up as a new venture.
And what about travel?
There's no evidence at all that there's any causal link between travel, air travel, and the development or exacerbation of lymphedema. My personal opinion is that it's the process of travel, the fact that you're out of your normal routine, doing things in places that you would not normally do, probably lifting luggage that you wouldn't normally lift, and that you're also probably a little bit stressed and tense, and therefore not giving your lymphatics the best environment to work and pump effectively. So that if you are able to stretch and do regular exercise, just simple stretching, hand pumping exercise, whilst you're travelling, you'll probably reduce your risk.
Should a compression sleeve be worn?
There's no evidence at all that a wearing of a sleeve will prevent the development of lymphedema. In fact, some people have suggested that you may be more likely to take risks and do things that you shouldn't do, thinking that the sleeve protects you. So unless you have any symptoms of swelling like ache or heaviness, I see there is absolutely no benefit to wearing a compression garment. However, if you do have ache or heaviness, but no sign of obvious swelling, there may be some merit in talking with a lymphedema specialist about trying a sleeve to see whether it prevents those symptoms. But there is no evidence that it will prevent you developing swelling.
What about injections and having blood taken?
Well, the advice for a long while has been absolutely not to have that done, but in fact the research evidence suggests that providing it's done safely and following the professional guidelines, there is a very low risk of developing any complications. So injections given by your chemotherapy nurse or blood taken by the phlebotomist is likely to be very safe. However, low risk is not no risk. So there will be a very small number of people who will develop problems. So it's a case of weighing the risks.
What about the effect of temperature?
Well, our bodies react to heat by generally swelling, which is why we have puffy ankles and hands in hot weather. And so the theory is that puts extra strain on the lymph system and is more likely to trigger swelling. However, there's no evidence that there is a causal link between temperature and the development of swelling, except there is a suggestion from a recent study that sauna can trigger the development of swelling. However, there is no evidence of a link between sunbathing and the development of lymphedema, but common sense suggests take good precautions.
Tell us about manual lymphatic drainage.
Well, manual lymphatic drainage is a specialised massage technique that works on the superficial lymphatic drainage system, directing fluid from the areas that are swollen or at risk towards the areas that we know that are functioning well. So in theory, it should help. However, the evidence is conflicting. Some studies show that there was some benefit in that some people who had the manual lymphatic drainage didn't develop lymphedema. Others found that it made absolutely no difference and the same proportion of people developed swelling. So the recent conclusion from a systematic review that was published of all the evidence suggests that there is no benefit. However, there's no harm. So you won't be offered manual lymphatic drainage on the NHS because there's no evidence for its benefit. However, if you choose to personally obtain it privately, there's no harm. It feels very nice and you may well enjoy it.
Given everything that you've said so far, what is the most important advice?
Firstly, live healthily and live normally. And secondly, assess the risk. There are certain activities that will be important for you or that you want to do and that bring benefit to you. Risk doesn't mean that you will develop problems with those activities, it just means there is a greater chance that you might. So you need to decide how important those are for you to live a normal, happy and healthy life.